Bismillah ar-Rahman ar-Rahim. Dear students, this lecture is concerned with the anatomy and the applied anatomy of the oral cavity and the contents of the oral cavity, including the tongue and the other structures. To start with this lecture, we should have some notes about the definition of the oral cavity, which is a space present as the beginning of the alimentary tract. It is regarded as the beginning of the GI tract, and it has three main important physiological functions, including digestion of the food, mechanical digestion of the bolus of the food, and also the oral cavity or the mouth, sometimes we call it the mouth, used for communication with others due to its function regarding the sound modifications and accommodations. And also the third function could be an alternative way of breathing when there is, for example, problem with the nose. The person can use the oral cavity as a way to aspirate or even to expel the air from the lungs. So the oral cavity or the mouth itself can be divided into two main divisions, and the space itself, as we can see here in the picture, is extended between two important points. The first one is called the oral fissure between the two lips, upper and lower lips, and posteriorly extend to the what is called the oropharyngeal isthmus, which can be seen here. I can indicate by the mouse here from the soft palate laterally there, and then to the epiglottis here, oropharyngeal isthmus, which is the narrowing of the cavity to communicate with the pharynx here. We call it oropharynx here when it is communicated anteriorly with the oral cavity proper. Now, the oropharyngeal isthmus can be delineated by the following points. First, we have the soft palate at the top, superior, and on each side laterally we have what is called the palatoglossal folds, which is the same as anterior foci of the tonsillar bed, the same called anterior pillar of the tonsil also. The anterior pillar, it is a fold, mucosal folds. We call it sometimes palato from the palate, palatoglossal folds, and also we can call it in sometimes the anterior pillar of the tonsillar bed of the tonsil, palatine tonsil. Okay, and then at the base or the inferior part of this oropharyngeal isthmus, we can see the what is called part of the dorsal part of the tongue. And here we have the valleculae and also the epiglottis. The epiglottis is one of the cartilages of the larynx. Now this oral cavity divided into two main parts. The main one, which is the oral cavity proper, we call it the mouth cavity proper, and the other is called the vestibule. And the vestibule, by definition, it is the space of the oral cavity outside the dental arches when the teeth are closed or opposite each other. When the person is closing or clenching his teeth, or the upper and lower jaw is closed, so the space between the cheek and the dental arches, we can call it the vestibule. Okay, so the vestibule is the space between the lips, cheeks, and the gum and teeth from the other side. The vestibule communicates with the oral cavity proper behind the last molar tooth of the person. When you can feel your mouth, when you put your finger between the cheek and the teeth closed, you can feel a gap behind the last teeth, whether right or left, and this space is the site of a communication between the vestibule and the proper oral cavity itself. Now, the proper cavity of the mouth lies posterior to the vestibule, and it is bounded by roof, which is the palate, whether soft or hard, the floor of the mouth also at the base, and also the cheeks laterally, and the tongue fills most of the volume of the oral cavity itself, and it's very important structure present in the oral cavity. Now, the roof of the oral cavity proper, as we mentioned, by the palate, and the palate, the anterior portion of the palate, yellow in color here in the picture, is called the hard one, or the hard palate. It is bony and separate the oral cavity from the nasal cavity above, while actually it is lined by respiratory epithelium and from above, from the nasal side, while from the oral side it is lined by the oral mucosa, the same epithelium as the oral mucosa. Now, the posterior portion of the palate, of the roof of the mouth, is the soft palate, what is composed of muscular, more or less muscular, with some glands, mucous glands, and also lined by or covered by the mucosa. From the oral side we have, as we said, the oral epithelium.